Can we start the session? Do we have first presenter here? Dr. Gautam JAIN. Yes, please.
Good morning. Can we start?
Yes, please start.
Good morning. My topic is effects of NDA laser capsulotomy on intraocular pressure and anterior chamber depth. As we all know, the lens is a semi-solid avascular biconvex structure and it contains lens epithelial cells which lies in anterior, pre-equatorial and equatorial regions, and the cataract can be age related or caused by UV exposure, smoking, poor diet, and it leads to lens opacification. And a posterior capsule opacification is a common condition after cataract surgery which caused by lens epithelial cells which grows on the posterior capsule, which impairs the post-op vision for the patient, and treatment for that is NDA laser capsulotomy, which creates an opening in the posterior capsule. And the few risks which associated with NDA laser is UL displacement and pitting, and few central macular edema and retinal tears. As a prevention of posterior capsule opacification, capsule polishing and sharp edge IOLs can be used, and NDA laser often needed despite preventive methods. Objective of my study is to investigate the effect of NDA laser capsulotomy on intraocular pressure and anterior chamber depth to assess the clinical relevance of these changes and their implications for the postoperative care. It is a prospective study which includes 123 patients who underwent cataract surgery and presented to us with the posterior capsule opacification at our center. We divided the patients in two groups according to the energy exposure. Group 1 includes energy less than 30 millijoules and group 2 includes energy more than 30 millijoule. We included all the patients with the PCO which diagnosed via slit lamp biomicroscopy and excluded the patient with the ocular comorbidities, active infections and cataract due to specific conditions like pseudo exfoliation and trauma. We measure the IOP using Goldsman applanation tonometer and anterior chamber depth via ultrasound biometry. As a pre-treatment, we dilated the patient with eye drop tropicamide and phenylephrine, and if needed, we use topical anesthetic also. As a post-treatment, we used eye drop moxifloxacin and eye drop dexamethasone for 2 weeks, and we monitored the intraocular pressure and anterior chamber depth at 1 hour, 2 weeks and 1 month. As a result of my study, I have noticed that there is a significant increase in IOP post-laser in both the groups, and group 1 includes a pre-laser mean IOP is 15.48, which peaks at 1 hour post-laser and which comes to baseline at 1 month. Similarly in group 2, but there is a group 2 showed a great peak increase as compared to group 1. And in terms of anterior chamber depth, the group there is a slight and significant increase in anterior chamber depth, which also comes to baseline, around baseline at 1 month post laser, as shown here. Also the changes in IOP and changes in anterior chamber depth. As the previous studies also includes the changes in intraocular pressure and anterior chamber depth by NDA laser capsulotomy. They mentioned that there has increase in intraocular pressure, but there is no change in anterior chamber depth. But in my study, I have noticed that there is transient increase in intraocular pressure immediately post procedure, but IOP returned to pre-laser level by 1 month, and anterior chamber depth there is a slight increase, especially in the first hours post laser, and it gradual decrease by 1 month follow-up. Findings support the safety and efficacy of NDA laser for managing PCO consistent with the existing literature. And as a take-home message, NDA laser capsulotomy is a safe and effective procedure for managing PCO. It leads to improved visual acuity, transient IOP elevation, and slight changes in anterior chamber depth. There is no significant complication, reaffirming the procedure's efficacy and safety. Regular post-procedural monitoring of intraocular and pressure and anterior chamber depth is essential for early detection of any complication. Thank you.
Doctor, you have taken the IOP readings 1 hour, then 2 weeks.
Yes, sir.
Why this kind of schedule you have chosen?
Sir, because there is many reference studies includes that IOP should be measured after 2 weeks after NDA laser capsulotomy.
No, what about the initial rise after the yak? What
Yes, sir.
about the period which is the where the IOP rises maximally?
Sir, at 1 to 2 weeks, sir. But I have taken all the data at 2 weeks for a reference point for all follow-ups for all the patients.
So you will wait for 2 weeks to record the IOP after yak?
Yes, sir.
For
First,
a
I have
clinician
taken.
who does yak today, the
Yes, sir.
IOP should be measured after 2 weeks?
Yes, sir. At immediate first 1 hour post laser and then after 2 weeks.
Okay, fine. Next
Thank
question.